Hey, we're back in studio with Dr. David Klein of the Stages of Life Institute. And if you want to know more about the Institute, go to suffernomore.com. That's suffernomore.com. And another site that I give you, and I'll repeat it again at the end of the segment, is stagesoflifevitamins.com. Stagesoflifevitamins.com. That is your portal to better living through nutraceuticals, and this is the way to get the real nutraceuticals, the ones that have been tested, they're assayed, and get these to your home, right to your doorstep, on time, every time, so you don't run out. Because once you've started a regimen of these things, your body wants to keep you doing it and keep you healthy and feeling at the top of your game. So, new technology always coming to the campus of the Stages of Life. Upper respiratory testing. What's that all about?
Well, it's kind of interesting. You know, you can go to the doctor's office, okay, and you'll have a cold, a cough, a misery, bronchitis, pneumonia, God knows what. There are lots and lots of nasty bugs out there. There are nasty bugs every season, every year, for as long as I've been around, and for 1,000 years before that, this is the way life is. The doctor sits there before you, and you're going to come in, you're coughing at him or in the general direction of your doc, sneezing into your arm, into your hand, you're touching the doorknob. Who knows? You're sharing it with everybody out there. We all do it. But does anybody really know necessarily what's causing their illness? So you're sitting there, you describe this to the doc. The doc is going to look back at you and look very, very intelligent, erudite, and give you an odd answer, which is simply little more than a wild guess as to what the problem is. And then in order for you to think that you're getting your money's worth out of this visit, you're going to get a prescription. Now, this is where the problem begins. Okay, there was a study that came out of the Journal of the American Medical Association just within the past week or two, which demonstrated something interesting. One is that when a doctor gives you a prescription for an upper respiratory tract infection, it doesn't shorten the symptoms, doesn't improve anything very much. But if they use a broad-spectrum antibiotic, there are more problems than if they use a narrow-spectrum antibiotic. Now, the conclusion was that if you're going to make somebody sick, give them a narrow-spectrum antibiotic. And it was enough to make me sick to think that this is what it's come down to. That, of the medications that we use to make people ill, this one is less likely to make you more ill than you were when you came in. All right. The better question is, why can't we figure out what's wrong with you so we can pick and choose if you need an antibiotic, and if so, what the right antibiotic might be? Now, we can do a throat culture, and that takes 3 days to come back. We might do a strep test, but that's marvelous if you have one of the other 30 likely possibilities. Okay, what if you have influenza? Well, we do have A and B flu testing, but there's 6 of them. Okay, so it's all a matter of a crapshoot. Okay, are you able to hit the number? Are you not able to hit the number? We have a technology that we're the first in the country as a physician-owned office where we do DNA testing of the nasopharyngeal secretions. What does this mean? It means we take a little tiny brush. We brush the inner portion of your nose with it, put it into this machine, and it will do what's called a PCR, which is just like it is on television with DNA testing. It replicates the DNA of the bacteria, the virus, whatever's in that nasal swab, and it allows us to identify it. This process takes 45 minutes. 45 minutes later, we're able to tell you what the bug is. Fascinating kind of a problem. Okay, so let's say that you've got whooping cough. It takes almost 6 weeks sometimes to get those results back. We'll know in 45 minutes.
Wow.
You may have influenza B. It takes 45 minutes. You may have influenza A. It takes 45 minutes. Now, I was the first patient that had this thing done. Why? Because I thought I was dying. I had this terrible cough. It took me off the air. Okay, I couldn't broadcast because I couldn't breathe. I thought I had influenza. I was ready to start myself on Tamiflu. As it turns out, okay, I had rhinovirus, enterovirus. It's a very interesting combination. All right, what do you do for it? The treatment is entirely different. With me, it was colostrum, echinacea, golden seal, licorice root extract, N-acetylcysteine, and guaifenesin, rather than taking a Z-Pack or rather than taking Tamiflu. Well, guess what? I got better with it. I felt good about it, and now we're starting to pick up these sorts of pathogens in our patients. So unless you know what you've got, unless you know what's wrong with you, you don't have a prayer to fix it. Now, why isn't this the sort of thing that's done elsewhere? Well, actually, the equipment's expensive. Okay, so once you get past the cost of the equipment, it's not so bad. You know, it hurts for a moment, as they say, as I wrote the check on this one. You know, the machine costs more than my first house. Okay, the testing itself is not terribly expensive, but the barrier to entry is. So you're not likely to find this, you know, at the doctor's office typically. You're not likely to find this at the drive-thrus. You're not likely to find this at the pharmacies. We have it. Why? Because I figured it was a good idea. And I like being first. First in the country kind of feels really, really good, even if it is expensive. But this is a marvelous technology. This PCR technology is now available here in Central Florida. 45 minutes into it. It takes longer sometimes to drive to the office than it does to figure out what's wrong with you. Well, oddly enough, okay, for an additional $50,000, I was able to do the same thing for the lower GI tract. Precisely the same thing. Now, we don't put a brush in your nose, okay? No, we have to take a sample in a somewhat less dignified manner, put it on the brush, okay, and then run it through the same machine. 45 minutes later, we're going to tell you whether you have Giardia lamblia, H. pylori. There are 32 pathogens that we're able to identify in 45 minutes. If you have norovirus, if you're somebody who likes going on cruises, you're going to know a lot about norovirus. Why? Because 1,000 people can get sick very, very quickly with one bug. If you're a school teacher, you know something about norovirus. Why? Because one kid comes in with it, everybody gets it unless you know how to take the appropriate precautions. So individuals with acute lower GI issues, we can figure this thing out in 45 minutes using this DNA testing. It is absolutely remarkable, and it's not cost prohibitive.
Well, I think about the cost effectiveness, doctor. I look this in another way. If you've got a problem in the respiratory area or the lower GI tract, you know, you're going to spend weeks, maybe months, looking for the right medication, the right treatment, and the condition could be worsening the whole time. Downtime from work, downtime from sports, downtime from the family, probably spreading germs to family. This way, you get in the car, you get down there to stages of life, and you nail it.
Quickly. You and I last year both ended up with whooping cough.
Yeah.
Okay. This is the sort of thing that would have picked it up very, very quickly. You suffered with it for weeks and weeks and weeks and weeks until I was smart enough to see it, okay? And then you're the one that told me that I needed to treat myself, and it was like because I couldn't see the issue in myself. One nasal swab, and it's done. It's absolutely incredible. It's revolutionizing the treatment of the acutely ill. Very, very interesting. You know, we're going to be I'm so impressed with it, okay, that I'm bringing other DNA testing into the office now, looking for other sorts of infectious agents. It is going to make our life a whole lot easier with regards to the treatment of the patient.
Now, we're going to get a lot of people who wonder, is this, you know, it's a question that comes up about everything, from cars to trucks to going to the doctor. Is this somehow insurable?
Yeah. Does your insurance cover it? Medicare covers it. Great. TRICARE covers it, and we're TRICARE doctors, okay? You know, at stages of life, you know, I have 12 years in the military. I'm one of the few TRICARE treating docs out there, but TRICARE covers it. Blue Cross covers it. Cigna, not so sure about, okay? That's something we have to discuss with them. We're trying to work that out with them. United Healthcare, not sure about them either. But Blue Cross and Medicare, TRICARE, all perfect for this. Marvelous technology. And what does it cost? You know, if you have a copay, Medicare, there isn't any. Okay, TRICARE, I don't believe there's much of a copay if there is any. With Blue Cross, it might be $50 or $60. And the peace of mind's remarkable. What do you do with your kid if the kid comes in sick? Okay, what do you do with yourself if you have a sick child? What do you do with your children if you become sick? The data becomes very, very important. You need to know what's going on. This is the fastest. This is actually the least expensive way to get the job done. Knowledge is power, and this stuff is outrageous with regards to the data that it gives you, and it gives it to you fast.
All right, very good. New technology, always on the cutting edge, is the Stages of Life Institute, and it's right here in our own backyard. It's in Longwood. I'll get you that contact information here in a moment, but I do want to mention a couple of things. One is suffernomore.com. suffernomore.com. The other is stagesoflifevitamins.com. And with the stagesoflifevitamins.com, you're going to find yourself finding the right nutraceutical for the right use for your life to enhance your life. And, of course, if you enter into the program, you get it on time every time without running out. And I always run out, so, of course, the program is fit for me. Now, Here's more contact information, including the phone number.
Our phone number is 407-679-3337, and our website is stagesoflife.net. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And let's see, our office hours are Monday through Thursday, 8 to 5. The health store that Rob mentioned with all of our nutraceuticals is open during those office hours, but we're also on the web, as I said, at stagesoflife.net, and you can purchase your nutraceuticals at your leisure, and we will ship them to you.